Resuscitation Council UK, in line with the ERC and in line with the international guidance ILCOR, have all come out with the new Resuscitation Council Guidance 2025, which is really quite exciting. For the first time in ages, there are some quite substantial changes. And there's a really good logical reason for this as well. So I'm going to just take you through fairly swiftly through what the changes are and the reasoning behind them. And then if you want to read more, it's all on my blog. So you can go into firstaidforlife.org.uk or onlinefirstaid.com. All the details are there. We're producing new infographics. We're updating all our materials to reflect the changes. Okay, the changes are pretty sensible. And, you know, it's quite refreshing for them to revisit this. So the big one is that for people that have been paediatric first aid trained, so if you have been on a paediatric first aid, the full 12-hour paediatric qualification, or if you come on one of our shorter courses and you come and use the baby mannequins and the child mannequins and have a go at doing CPR on them, then we will be teaching you 15 for 2. So 5 breaths first, and then 15 compressions to 2 breaths. And the reasoning behind that is that when children have a cardiac arrest, it's usually secondary to a reversible respiratory issue. So breathing into them makes a big difference and can actually reverse some of the oxygenation issues. So they don't retain oxygen like an adult does. So that's why they need the 5 breaths first. And that's why the 15 to 2 is more important, because the breaths are more important to them. So if you are on an adult emergency first aid at work course or first aid at work course and you're not covering paediatrics at all, the mention, if they mention the paediatrics, will just be 30 to 2, exactly as it's always been 5 breaths first. But if you are responsible for children and looking after children and doing a paediatric first aid course, then you will be taught this change, which is 5 breaths first and 15 to 2. The other thing that has been changed is when you are doing compressions on a baby, instead of the old way that we were teaching 2 fingers, in fact, on our courses, I did always teach this way because it's the way that I have always done CPR on a baby in a hospital situation. So I would always be teaching it with 2 thumbs. So they have brought in that actually 2 thumbs together and putting your hands around like this, and obviously you're on a firm surface, but I'm showing you like this for now, you would give your compressions like that. And obviously they would be horizontal and on a firm surface. Likewise, if you're looking after them for choking, you've done your 5 back blows like that. And then if those 5 back blows haven't worked, you're now doing your chest thrusts with the 2 thumbs in the same way. So upward thrusts with 2 thumbs. The other thing that has changed is that they now want the pads on a child to be placed to the left of the midline. It may look different on this because obviously it's a mirror phone, but you need them so that it's on the left-hand side. If you can see here, that's their midline, and the front pad goes just to the left, and the back pad will go right in the middle, as it always has done. They've also divided up paediatrics in a far more sensible way. So a baby's 0 to 1, a child's 1 to 12, and your adolescents are your 13 to 18-year-olds. So for a baby, you are doing your chest thrusts, you're doing your five breaths into them first, obviously just a horizontal for a baby when you're giving the breaths, and you can give your mouth over their mouth and nose. Your chest thrusts or your chest compressions are given with 2 thumbs, and you're going 5 breaths, 15 to 2, 15 to 2. For a child, you are giving 5 breaths first, open the airway, hold their nose, and seal round to give in the breaths. And you're just breathing into them enough to make the chest rise. So don't overblow. And then you're giving the compressions. And for both babies and children, it's 1/3 of the depth of the chest. Don't forget the pads. And for an adolescent, you're going down 5 to 6 centimetres. You're still giving the 5 breaths first, and you're pushing down hard and fast, but 5 to 6 centimetres. So again, 15 to 2. So that is a difference, and it's a logical difference as to what we're doing. For the pad placement for an adolescent, look at the size of them. If it seems sensible to put the pad left of the centre, then fine. If not, do the same pad placement as you would do for an adult. And for the adult pad placement, they have said it's important to make sure that that one on the side of them is closer to the armpit. So just a little bit higher than maybe you were putting it on previously. You want to try and get the ventricles of the heart between the 2 pads. So the bottom part of the heart between the 2 pads. That's what you're trying to do. The other update on adult CPR is that they would like you to call an ambulance a bit earlier. So if you have an unresponsive casualty, they've said get an ambulance on the way pretty quickly, phone 999, and you can be checking for breathing whilst you're waiting for the call to be answered. So put the phone on speaker and be checking. And that way you can double check with the call handler, because sometimes it's quite difficult to know whether or not they are breathing normally. And the other things they've told us to look out for are panting, particularly post-exercise. Some people exercise, or a lot of exercise can trigger a cardiac arrest, sometimes, rarely, but sometimes, and the person might be panting. So look out for panting. If they are looking unwell with it, then be aware that they could suddenly collapse and it could cause be a cardiac arrest. So panting, strange breathing, abnormal gasps with a gap in the middle, seizure-like activity, all those things we should now be thinking, could it be a cardiac arrest? Few minor additional ones. So drowning, previously we only taught lifeguards to give 5 breaths first. Now we're teaching everyone. So drowning again, because it's a breathing problem, we want to re-oxygenate them quickly because lack of oxygen is a reversible cause of cardiac arrest. So we want to get our breaths in quickly. So everyone will be taught 5 breaths first for drowning. We're now teaching people jaw thrust on first aid at work courses if we're worried about a spinal injury. If you're on a shorter course, you'll still be taught tilt head, lift chin, as we have always taught. If someone has an amputated part, you should put that amputated part in a moistened cloth, moistened with water, and then wrap it, put it in a watertight container. Make sure it's not sitting in water, it's just moist, so it's not in something dry, it's just moist. And make sure that there's no water around and that the amputated part doesn't come in contact or direct contact with ice as well. Hypoglycemia, sometimes you find children are reticent about taking the medication if their blood sugar's gone so low. So they've said that you can actually mix some sugar in. More details on that, sugar in water, and that might be more palatable for them. Obviously, you're not doing that if they're unconscious. And anaphylaxis, importantly, the second injector, auto-injector, if you need to give a second one, you should give it in the opposite leg, because adrenaline is a vasoconstrictor, And obviously the blood circulation is better if you haven't just constricted the vessels in the leg you've given it, if that makes sense. So use the opposite leg for the second one. If you're using Neffy, and we've got more information coming out on the new Neffy nasal spray to give adrenaline in anaphylaxis. If you're using Neffy, it can be in either, actually they prefer it two in the same nostril because the first one primes it. So that is the advice on that. That is an awful lot of information, very fast. There is much clearer information on my blogs. So onlinefirstaid.com, firstaidforlife.org.uk. Subscribe to our newsletter because we're sending out a lot of updates on this and some really useful infographics for you to share. Share this if it's been useful to us, to you, and do keep in touch. Many thanks for listening.